Hi Danielle, my name's Dr. Brennan. I'm going to be one of the doctors looking after you here in the rehab. I read a little bit through your chart. I was hoping actually, if you don't mind, if you could tell me a little bit about what brought you in last night.
All right, I guess I really screwed up, I got brought in by the ambulance, and they tell me I OD'd.
You overdosed?
Yeah.
Oh my, I'm sorry to hear that. Where were you, Danielle?
I was in my parents' house.
Okay.
Parents' basement.
Okay. And sort of set the scene for me if you can. Were you in a bedroom, in a bathroom? What were you doing?
So I was, I try not to live with my parents, but I do go back and stay with them a lot.
Sure.
Been having trouble for a while.
Okay.
And I just went into the basement and sort of did what I normally do. And I guess, they're always worried when I'm around.
Of course.
So they were down there, and I just did, shot up, and then I guess I passed out. I mean, honestly, all I remember is being in the bathroom. And
oh my.
Next thing I know, the EMS is there.
Okay. Okay.
Parents are screaming and crying.
Oh gosh. Okay. And what did you shoot up, Danielle?
It was heroin.
Heroin. Okay. Have you been using heroin for some time now?
I have for, it's like about a year, I guess.
A year. Okay. If you don't mind my asking, were you using something different before the heroin, or did you start with heroin?
I mean, there's a lot of stuff, but yeah, I started with Oxy. I was still in college, but I had some pain, and somebody gave me one, and I liked it, and it just totally spun out of control.
Okay.
From there.
This is oxycodone you were using. Okay.
Mm-hmm.
How much of the oxycodone were you using per day?
I don't know, but like probably, handfuls, but like 20 or something a day.
Okay.
It was killing me.
Okay. And then when you switched over to the heroin, did you start by snorting it originally?
I did, but
Okay.
it pretty quickly went to IV. Just the people I was getting it from, that's what they were doing. I kind of don't even know how I got there, but that's what happened.
Okay. And have you had any other treatment admissions for this heroin problem? You have?
Detox.
Okay.
It's the same thing over and over again. And, it does help me. I feel better. And then I feel like I'm almost kicked out, and then I'm back again.
Okay. When you've left the detoxes in the past, how quickly do you tend to start using heroin again? Is it almost that same day?
Yeah, I mean, sometimes it's like 3 hours.
3 hours.
Other times I've made it a couple days.
Okay. Other drug issues for you? Are you using any cocaine, any benzodiazepines,
Cocaine
stimulants?
From time to time, when I feel like crap, I'll do whatever I can get my hands on. Xanax is pretty steady for me too,
Xanax.
though.
Okay. How much are you using per day, Danielle?
Probably, 2 milligrams or something like that.
Okay. And when you've come into treatment in the past, you've been treated for both the heroin and the benzodiazepine issues?
I usually, I guess I'm off everything just before I leave, but not for very long.
Okay. It sounds like what probably happened to you this time is that, and I think I read in your chart, is that your parents found you on the ground, and they understandably were terrified. What they did actually saved your life. They gave you a dose of a medicine called naloxone. They squirted that in your nose. My guess is you don't remember that, but
all I remember is that cut on my head.
The cut on your head, yeah. Well, we can take care of that. And then you actually got a few more doses when you came here to the emergency department, and then thankfully you had the good sense to come into treatment. Perhaps one of the things you and I can talk about is how we can make this treatment a little bit different from the treatments in the past. It sounds like you haven't really benefited from these detox admissions throughout the last year.
That's right. I mean, I'm not knocking them, but it just hasn't helped enough.
Okay. Can I ask you, Danielle, has anyone ever spoken to you about what we call medication-assisted treatment for opioid use disorder?
I mean, I've heard of BUP and things like that.
Of BUP, okay. So if you don't mind, why don't I sort of introduce it to you in broad terms, and then you and I can get as specific as you'd like as far as what the different medications are?
Okay.
Would that be okay?
Yes.
All right. So when we talk about medication-assisted treatment, what we're fundamentally talking about is a medicine, right? Not all drug and alcohol treatment is based in medications, but for opioid use disorder, we actually do have a couple medications that we can use that can be quite helpful. So I think it's helpful if we sort of divide it up into two big categories. The first category is what we call agonist-based treatment, and the second category is what we call antagonist-based treatment. Now, if you haven't taken a science class or a pharmacology class in a little while, you probably don't know what those words mean, but I can explain them to you. So an agonist is something that hits those opioid receptors in your body and turns them on. That is, it gives you a lot of the same feelings and effects that a regular opioid, like heroin, for example, would give you. Now, you may say, well, why would a doctor, why would a doctor prescribe that? And when you think about it, actually, it's that we're just giving you opioids, but we're doing so in an incredibly safe manner, right? So, for example, if somebody's out there injecting heroin, putting themselves at risk as far as how they ascertain heroin, spending all the money that they have in order to get heroin, and finding themselves in typically very risky, and in your case, life-threatening situations while using heroin, if we give them an opioid agonist, and there's two of them, and we'll go through them together, they don't have to go out and hustle for drugs. They don't find themselves on the bathroom floor of their parents' house. They're seen by a doctor in a clinic. They're seen by a counselor in the clinic. They're not having to spend their money on these medications because they're covered by insurance. And it basically allows them to receive an opioid and go about their day. They can get jobs, they can go back to school, they can really grow and spend that year or two or three or however long it is equipping themselves with what I like to call a tool belt of recovery, right? You got to work on some other areas in your life to stay sober. And by engaging in what we call opioid agonist treatment, it allows you to kind of get on with things while continuing to receive an opioid. Does that make sense at all?
It does. I mean, it's weird. I've never heard much about it, but
okay.
Yeah, I mean, mostly I just want to be able to get back to school. I know I'm a long way away.
Okay. What have you been studying?
Psychology, believe it.
Psychology. Okay, I can believe it. Well, good for you.
Okay.
That's exciting. It's a great field.
Thank you.
All right. Well, why don't we talk now about the other type of treatment that's in medication-assisted treatment. That's called antagonist-based treatment. Okay. Not surprisingly, it's kind of the opposite of agonist-based treatment. An antagonist is a medication that goes onto a receptor and actually blocks it or turns it off. So in this case with opioid use disorder, we have a medication called naltrexone that's available in a once daily oral form or a once monthly injectable form that you get in the rear. It literally blocks your opioid receptors, so you'll be unable to use opioids. You can go out and try to use them, but they won't work. Now you may say, well, why would I be on something if I can't use opioids? And that's the whole point, right? I give you something to block you from using. Distinct from the opioid agonist treatment, this medication does not give you any of the same effects that the opioids do. There's no pain relief, there's no feelings associated with any opioids whatsoever. It literally blocks those receptors, and we certainly offer that treatment here as well. But it's totally different than the opioid agonist treatment.